right, welcome back to another PCBH Corner. I'm David Bauman, and we have Brittany Houston here today. It's a fun time during COVID that we're doing one of the first PCBH Corners live since COVID happened. That's why we're wearing masks, trying to social distance as well. Brittany, do you want to introduce yourself to the group?
Yes, so I am Brittany Houston, as Dave mentioned, and I'm currently a postdoctoral fellow here at CHCW, and moving on to UT Austin later on in a month or so.
So not to put a lot of pressure on you, you are the first trainee that has ever been on a PCBH Corner, so this is high praise, yeah. So speaking of that, I think the first question that I have is related to trainees and getting into PCBH. And I know this is a broad question, but is there any advice that you would give students if they're watching this, if they're in their doctorate or their master's program, maybe they're about to apply for internship, maybe they're about to apply for their fellowship, any advice that you would give them when looking at programs for PCBH and what they should be striving for?
Yeah, so if this is a new interest of yours, I definitely would look into some of the pieces of PCBH. If you like to work with a team, if you are flexible, if you like to be on the go. I think that one thing that we have to consider in going into a PCBH program is that there is an identity shift, right? If you've been traditionally trained as a specialty mental health professional, you almost have to switch from thinking as a therapist into thinking as a primary care provider. So you are part of the PCBH culture. And so I would suggest, looking at what that culture is supposed to look like. We're supposed to be supporting each other. We're supposed to be a part of the team. We're supposed to be a part of leadership. So, and the primary care providers are also supposed to be a part of us, right? So if you can find a program that is PCBH, make sure that some of their PCPs are interviewing you. That lets you know that that they are working as a team. Make sure that a resident is interviewing you because they're going to be a part of the team that you're working with. And so really start to pay attention to those undertones that not only that represent what a PCBH model is. Not so much about what is on a website, but what they're doing.